What we're doing here is we're doing a connective tissue graft on a model, and today we spent the day going through some soft tissue procedures, both around teeth and around dental implants. And we're harvesting a connective tissue graft from the palate, utilizing this single incision technique, which is difficult in the mouth and even more difficult on the model. So the participants are getting the opportunity to harvest a connective tissue graft with one incision, close that incision, and then place the connective tissue graft on a labial of 2 posterior molars, utilizing a coronally repositioned flap, vertical incisions, and periosteal suturing. So challenging to do in the mouth and on the model, but certainly a good experience. If you can do it on the model, then you can certainly do it in the mouth. Tomorrow we'll do some hard tissue regeneration utilizing the same model, placing implants and doing some horizontal augmentation, utilizing a combination of resorbable membranes, dental implants, and bone graft material. What we're doing here, guys, is circumferential sutures. All right, we're doing a suture that, okay, if this is the tooth, okay, and here's your bone, and here's our graft. Now we want to pull that graft tight to the tooth, right? So what we're going to do, and this is periosteum down here. What we want to do is we want to pick up the periosteum, like so, come over the graft, come around, and then tie. So this suture here is going to pull toward the root, okay, toward the graft, and eliminate this, what we call dead space between the graft and the tooth. Dead space is going to get filled with a blood clot. The blood clot may or may not turn into connective tissue, probably won't. It'll probably necrose and you're going to lose the graft. So what we're ending up doing is we're going to do a suture that, here's the tooth, we have recession down to here, we'd like to get the graft up to here. So we're putting in our graft, like so, and our suture is going to be picking up the periosteum deep, going over the graft this way, coming around, and tying. So it's like an X, okay? That X is pulling everything very closely. We're day two of a 2-day seminar in bone grafting and soft tissue. Today we're going to be placing one implant in the anterior aesthetic zone, utilizing an augmentation with bone and an OsseoGuard membrane and coronally reposition the tissue. We're also going to be doing a socket graft procedure with bone graft, collagen membrane, and suturing it. Yesterday we did connective tissue graft. Today we're following up with some hard tissue regeneration. In the background you can hear the drills drilling as they're putting in their implants right now during the conclusion of our 2-day program.